Hello, and thank you for taking a few moments to join me as I talk about healthy and impaired lungs. My name is Amaima Ali, and I am a registered respiratory therapist at West Park Healthcare Center. The focus of this presentation is to provide a general overview of the airway and the lungs. It will also discuss the importance of oxygen in our daily lives and allow us to briefly review some of the impairments that can affect the health of our lungs. Our lungs are the organs of breathing. They are located in the chest cavity. They start from just above the collarbone and end just above our belly button. We have two lungs, the left and the right. The left lung is further divided into two lobes, and the right lung is further divided into three lobes. Our heart is located between our lungs, closer to our left side. The heart and lungs work very closely together in order to provide oxygen to our cells. The lungs provide the heart with oxygen-rich blood, and our heart works to pump that blood out to our tissues. Inside of all of our tissues are cells which require oxygen to function. The heart also is made of tissue which need oxygen to work, and so without oxygen, our entire body would just stop working. So what is oxygen? We often talk about oxygen as being very important to our overall function, but if we think about oxygen as a fuel source, it might be easier to understand. Oxygen is fuel that our bodies need to work. Every single cell in our body requires oxygen to function properly. When we breathe in oxygen, it is absorbed into our blood and carried throughout our body to our tissues. When the cells that make up our tissues and muscles use this oxygen, they release a waste product called carbon dioxide. The body is able to release carbon dioxide as a gas in our exhaled air. Our lungs' primary function is to provide our tissues with oxygen and also to get rid of carbon dioxide. Now let's follow the pathway of oxygen absorption and carbon dioxide removal. When we take a breath in, our diaphragm moves down. The diaphragm is a muscle that is located just below the lungs, and when we breathe in, our diaphragm moves down. This allows for the lungs to expand and fill with air. The air in the atmosphere contains oxygen. Air will first pass through the nose and the mouth and then down our windpipe, known as the trachea. The trachea then further divides into the left and the right mainstem bronchus, which then further divides into smaller and smaller airways until eventually reaching small air sacs called alveoli. This is the point at which the oxygen in the inhaled air is able to diffuse into the bloodstream. Now oxygen is in the blood and can be taken to the heart and pumped out to the rest of the body. Back at the alveoli, the oxygen is moving into the blood. Carbon dioxide is leaving the bloodstream and moving into the alveoli. Now we have carbon dioxide ready to be released when we exhale. Our bodies have some natural protection built in. This starts from our nose. The nose not only provides us with our sense of smell, but also acts as the first line of defense to filter out debris from entering into our lungs. The nose also provides air with some moisture, and so when air enters into our lungs, the air is clean and humidified. The air that is warmed up, humidified, and filtered can now move down the trachea and into the right and the left bronchus, and eventually down into the alveoli. Lining the bronchus is another defense mechanism of our airways. Cilia are small hair-like projections lining the upper airway, which work to trap debris and move mucus from our lungs up and out. They constantly move and act like an escalator for mucus to move from inside the lung toward our nose and our mouth. They help prevent mucus from staying stuck inside of the lungs, which helps to prevent against infections and bacterial growth. When cilia become damaged, either from exposure to toxins such as cigarette smoke or other chemicals, they lose their ability to function. This causes the mucus to become stuck inside of the lungs, increasing the likelihood of lung infection. Mucus also will then accumulate in the alveoli, making it more difficult for oxygen to enter into the bloodstream. There are many different reasons making it difficult for the lungs to do their job. Now let's break down the most common types of lung impairments. We divide lung impairments into two major categories. They are either obstructive or restrictive, or they can be a mixture of both. Now let's start with obstructive lung disease. The most common type is referred to as COPD, which stands for chronic obstructive pulmonary disease. COPD is a combination of emphysema and chronic bronchitis. 90% of COPD is caused by cigarette smoke. However, it can also be genetic or from environmental toxin exposure or even due to frequent childhood lung infections. Emphysema causes the alveoli to become floppy and damaged, whereas chronic bronchitis causes an increase in mucus production. It also causes the airway to become damaged, making it harder for mucus to move up and out of the lungs. Other examples of obstructive lung impairments include asthma, bronchiectasis, and cystic fibrosis. Asthma is when our airways narrow, making it difficult to breathe in and out. Often people experience flare-ups due to environmental allergens and require immediate access to medication to help open up the airways. Bronchiectasis affects the airways. It causes the airway to become floppy and wider and also damages the cilia, which are meant to protect the airway from debris. This results in increased mucus trapped in the lung, making it harder for oxygen to move in. The increase in mucus and the body's inability to move the mucus out results in frequent lung infections. Cystic fibrosis is caused by a genetic mutation, which results in multi-organ involvement. The lungs are affected because the mutation causes the mucus to build up and become very thick inside of the lungs. When there is too much mucus lining the lungs, it makes it harder for oxygen to make its way into the bloodstream and causes carbon dioxide to remain trapped in the alveoli. The increase in mucus also causes an increased chance of lung infection and illness. All of these impairments fall into the obstructive category because they all ultimately affect the airflow into and out of the lungs. People with obstructive lung disease have difficulty in breathing air out of their lungs. On the left-hand side, you can see a normal alveoli, and on the right is a damaged one. The alveoli look floppy, and there is less overall surface area available for oxygen to diffuse into the bloodstream. Air filled with CO2 is also left trapped in the floppy alveoli, and so it leaves less room for new air with oxygen to enter into that space. This prevents oxygen into the bloodstream, resulting in the loss of lung function and decrease in the availability of oxygen to the body. The CO2 is constantly produced as a waste product from our cells, and if it cannot be exhaled, as in the case of obstructive lung disease, it starts to build up inside of the alveoli. An increased amount of CO2 inside the lungs is damaging. Excess CO2 will cause tiredness and drowsiness. Oftentimes, when there's too much CO2 left inside of the alveoli, we can experience daytime sleepiness and headaches. We can become confused and find it difficult to concentrate. Also, since there is not enough oxygen being moved into the bloodstream, the heart has to work harder to pump out enough blood since the blood contains less oxygen. The second type of major lung impairment is referred to as restrictive impairment. In this type of disease, the lung volumes are affected. A person will find it difficult to breathe in and will find it hard to get a full breath in. Oftentimes, restrictive lung impairments can be described as if the lungs are trapped inside of a cage and cannot fully expand. Examples include pulmonary fibrosis, obesity, scoliosis, infection, and neuromuscular diseases such as MS or ALS. Pulmonary fibrosis is a form of interstitial lung disease. In pulmonary fibrosis, the lung tissue becomes fibrotic or scarred. It makes it more difficult for the oxygen to pass through the lining of the alveoli and reach the bloodstream, which decreases the amount of oxygen available to be used by cells. The scarred tissue also makes it more difficult for the lung to expand and fill with air, making the work of breathing harder and require more energy. Now, with obesity, there is more abdominal fat, which pushes against the main muscle of breathing, the diaphragm. When the diaphragm cannot move down fully, it leaves less space for the lung to expand, to take in a full breath. Obesity affects the entire body and creates a higher work demand for all of the organs, including the heart. In some cases, an obese person can develop obesity hypoventilation syndrome. This is when an increased pressure on the chest wall from excess weight doesn't allow a person to take in a deep enough breath to maintain effective levels of oxygen in the blood. Another restrictive impairment that also does not allow for deep enough breath is scoliosis. In some cases, the angle of the spine is so curved that it affects the movement of the rib cage. When this happens, a person cannot expand their lungs effectively enough to maintain adequate oxygen levels. In this case of neuromuscular diseases, the muscle of breathing, including the diaphragm, and the smaller muscles found between the rib cage begin to weaken. When this happens, the muscles themselves cannot move the chest out enough to allow for effective air movement into the lungs. The pleura, which is the lining of the lung, can also thicken. This condition can be due to long-term accumulation of fluid or a sudden infection. When fluid fills the lining of the lung, it puts pressure on the lung, and so we cannot fully expand our lung tissue, making areas of the lung start to collapse or close off. This will decrease the amount of oxygen we can effectively get into our blood. When a body is at rest, it requires a certain amount of oxygen or fuel in order to work. When the body starts to move, it will require more fuel in order to keep up with the demand. So if we think of oxygen as a fuel source and the work of the body as the demand, we can see here at rest in a normal healthy lung, the fuel is enough to meet the demand. When the demand of our body increases, say when we start to walk or exercise, in a healthy lung we begin to breathe deeper and have our heart pump faster in order to meet the increased demand with enough fuel. In an impaired lung, the fuel source may not be enough to meet the demand of the body. We may not feel the effect of low oxygen when at rest because our body's demand might be met at that time. However, when we have an increase in our demand, the lung cannot keep up enough supply of fuel to meet our needs. Sometimes in an impaired lung, the fuel is not enough for the body even when at rest or during sleep. We need some extra oxygen to fill that gap in our fuel source. This is why oxygen prescriptions can change depending on what you are doing. It is important to listen to your body's natural cues for when there is a gap between the amount of fuel you have left and the amount of work your body is doing. Some examples would be feeling short of breath, feeling your heart beating too fast, and feeling tiredness in your legs. All of these cues tell you that there is a shortage in oxygen for the amount of work your body is requiring at that time. This is when you can take a break, sit down, and focus on your breathing. Try taking deep breaths in through your nose and out through your mouth while pursing your lips together. These actions are meant to slow down the demand of the body so that you can maintain enough fuel to stay healthy. A few other ways to manage your lung impairment include maintaining proper bronchial hygiene through various devices that can be prescribed to you, and using oxygen as it is prescribed to you. As we discussed earlier, our body will require different amounts of oxygen while we do different activities. And so it is important to always try and keep the level of fuel at the level of the body's demand. Stop smoking. Smoking directly damages your cilia, which are the lung's line of defense in keeping your lung clear of extra mucus and bacteria. Smoking is also the leading cause of COPD. Maintaining a healthy weight will also decrease the effort required to breathe and lessen the work of your heart, making it easier for your lungs to keep up with the demands of your body. Learning effective ways to breathe and knowing when to slow down will also allow you to be more aware of your body's needs at different times of the day. And lastly, it is very important to take your medications as prescribed to you in order to prevent flare-ups of shortness of breath and also in order to manage your impairment long-term. If you require more information on a specific type of lung impairment, consult your doctor. Thank you for joining me today. I hope you have found the information presented informative and helpful.